Hi, I'm Delaney Gabriel. It's August 14th, 2019. I'm a holistic health practitioner in Santa Barbara, California, and I'm making this video today about anxiety, depression, hypertension, the kinds of things that arise after people have had stress for quite a while. So I'm sitting here in my office in Santa Barbara at State and Carrillo Streets with my assistant Shelly, and she and I were having a conversation about stress, and I invited her to come in and have that conversation here on video instead of out at the front desk. So I'm going to talk to you. I've probably got about 8 or 10 supplements and things that I use typically for treating anxiety disorder, stress, that kind of thing. So I just did a video on L-theanine, so I'll be talking about that too. But Shelly, what's on your mind that was so important?
What supplements can you take rather than Xanax?
Rather than Xanax?
Yeah.
That's what you're hitting me with?
That's right.
That's a heavy one. And part of the reason that it's heavy, and you and I had a discussion about this sometime earlier, was that a lot of people are taking Xanax, but they're not really getting real Xanax, and they're not getting it through their doctors. They're getting it off the street,
right.
And they think they're getting Xanax, is that right? But they're really not.
Right, most of the time.
Whew. And that's really, really dangerous. So what I have for those of you who would be interested in some natural products that really do work, alternative things, holistic kind of things, supplements, because what I know about depression and anxiety is that it can have a lot of different roots. For example, it can have roots in hormones. So I have a product, progesterone cream. If it's a hormone issue and you're all revved up and you can't sleep and it's hormones, then these other things that I'm going to mention will likely help you, but they won't do the job that if you added progesterone. And then if you need progesterone and estrogen, I have this one called Pro-Trias Cream. That's half progesterone and half of 3 different kinds of estrogens. But I'm going to save this for a different video. I just wanted to let you know that really, if it is a hormone issue, especially for women, if your anxiety is intensified around your menstrual cycles, or as you age, you lose your estrogens that you need to help you deal with stress and are very important to secure the cardiovascular system and keep it nice and lubricated, then certainly estrogen would be something you'd want to take. So let's get into the line of things that I use. And I'm going to present these to you in pretty much the order that I recommend to my clients. So for those who need like immediate relief from stress, their blood pressure's up, and it's because of an event, prolonged undue stress that comes up.
Would that help with a panic attack?
Panic attack, it absolutely can. I notice that I'm going to say things can. I'm not saying they will, but it's very likely that they will, and I know that they can. So the L-theanine drops would be the kind of thing to use for that, because they work really fast. Within generally 5 to 10 minutes, at least with 20 minutes. And on an earlier video, I showed how I take mine. I could probably use a little bit more right now to do this video. So you take the pump and you squeeze it and you get it full like that, and then you put it under your tongue like that, and you try to hold it there for a minute or 2 before you swallow it. And then that gets into your bloodstream and has a nice calming effect on the body. Then I use that for, like I said, sudden stress, things that come on that you need help in that moment. Otherwise, one of my favorites is this one called L-theanine capsules. This is 200 milligrams, and the typical dosage is to take 1 in the morning and 1 at bed. A lot of people wake up with anxiety. A lot of people go to sleep with anxiety. For most of my clients, this lasts in that 12-hour category where they get relief from it, but there's other people who have to take it every 4 to 6 hours until they get the levels built up, or until they get through with a certain amount of stress. And then they can get by with sometimes once a day and then some drops as needed. Another thing that I love is GABA and 5-HTP. These are amino acids. When I look at treating hypertension, which is high blood pressure, anxiety, nervousness, those kinds of things, I'm always looking for what is deficient. What's the cause? Why is this happening to you when somebody else in a similar situation isn't responding to the stress at all in a negative way? So with this being amino acids, these work off of the brain, because a lot of times the stress, it's not the actual stress, it's the perception of the stress and what it feels like to you. So with GABA and 5-HTP, again, I'm pretty much a 1 twice a day kind of practitioner in the morning and at bed. Sometimes people do well taking 1 L-theanine in the morning, 1 GABA and 5-HTP in the afternoon, and then another L-theanine at bed. Then separately, I have 5-HTP, which is 100 milligrams, so it's twice the dosage that it is in the GABA and 5-HTP. Some people do really well just taking 5-HTP on its own without the GABA, and you kind of won't know until you tried it. If I were going to recommend something for you, I would ask you if you have sleep issues. And if you do have sleep issues, I would say then take 1 of these at night or 2. And it can really work to calm the brain to let you sleep, because a lot of sleep issues, again, could be hormonal, or it could be that your brain is just still sizzling and working and overworking and thinking and overthinking. And then another supplement for depression and anxiety is this one called SAMe. And it's another amino acid that can be very effective, and typically just once a day does the job on this. It's been very rare that I've ever had to have anybody take 2, but do keep in mind that I use some of these in combination. And at the end, and Shelley, if I forget, remind me, I want to go give people an idea about what I would want as a starting dosage, instead of having them say, well, there's a dozen things here, what do I do? Another one of my favorites is DL-phenylalanine. This is another formula of amino acids, and what I love about this is if someone is depressed, if they have anxiety, and there is pain related, like physical pain, aches and pains, headaches, that sort of thing, I love DL-phenylalanine for that. Because I do find, and everybody listen up here, I really do find in my practice and with my clients that a lot of the times people have depression or anxiety is from physical pain, aches and pains, chronic fatigue kind of pain, Epstein-Barr virus kind of pain, even if it's undiagnosed. But if people, I remember I used to ask my Italian mother-in-law, like, how are you doing today? And she would say to me, oh, I hurt. Because her body just hurt, and she felt the pain of that a lot, and then she was pretty depressive to be around, so I added some DL-phenylalanine for her and had her take 3 a day of these. And then when I would ask her, so Mom, how are you doing today? She would say, well, I still hurt, but not as bad. And it was a completely different tone in what I would hear from her. Then, don't go crazy on me, people, when I talk about this, okay? This is lithium orotate. So I know that lithium is heavily associated with schizophrenia, lithium in a different form, in a high dose prescription, is for schizophrenia. I don't like that. I wouldn't use it because I don't treat clients or patients who have schizophrenia. That's really out of my comfort zone. But I love this lithium orotate. It's been on the market for 30 years, and this is one of my private label. It's something that I take because I just have a long history of depression for some really good issues. I often say we're adults acting out our childhood and feeling our childhood pain at one time or another. So then the brain gets programmed that way. And although now my life is good and I'm grateful for that, there is just, like I said, this programming that seems to get stuck in the brain, and we want to go back to that worry and all that we do, and the memories and the trauma. So that's why after all these years, I still take lithium orotate. A good dosage for most of the people, most of the time, of lithium orotate is 1 in the morning and again 1 at bed. Then if during the day those haunting kind of feelings come back to you, or the anxiety creeps up, or you feel like you're going to get in trouble, you're going to get scolded, something's going to go wrong, then that's when I reach for another one of these. So it would typically be one of them twice a day, or maybe that third one, like I say, if those haunting thoughts kick in. One other reason that a lot of people are depressed and suffer from anxiety is because they're deficient in vitamin B12. It's not just in older people, it's in younger people, and it's pretty rampant in vegetarians, because vegetarians are not eating beef and things to get the vitamin B12. And this is it's a sublingual formula, means you put it under your tongue. Otherwise, there's this thing in the stomach called intrinsic factor, that if you're just taking vitamin B12 in pill form, it likely won't work if you're swallowing it. So I like this one because it's in a good balance with folate, and it's the specific kind of L-methylfolate that works for breaking down folic acid and getting that right kind of balance. So again, people who are depressed or have anxiety, or just kind of punchy kinds of reaction, if you walk up to them and get too close in their energy field, oftentimes that's a vitamin B12 deficiency. And the dosage for this typically is just 1 a day. Some people, if you're really deficient, would need to take 2 a day, and you could take them at different times of the day. A lot of times doctors will do a blood test for vitamin B12 and folic acid. If you're going to get the vitamin B12 tested, it needs to be a different test, not vitamin B12. It's called MMA, methylmalonic acid. Then we can diagnose it, because most people, even people with cancer and going through chemotherapy where their vitamin B12 is just wiped out, will come back with a high level of vitamin B12 showing up in their blood, but it's not in the cell, it's not where it needs to be. So this kind of vitamin B12 will do the job. So what you got, Shelley?
Do you take all of that together, or how do you dose
so
that out?
What I would
It's a lot
do,
of pills.
It's a lot of pills, and it is like, okay, I've got all this information, what do I do with it?
Right.
L-theanine drops, definitely these to have on hand for those sudden responses that your body has. And if any of you, have you heard of Rescue Remedy? Do you know about that? Okay. Well, you're not deficient in anything, any of those ingredients, any of the herbs. We don't have herbal deficiencies, basically. And it's not that herbs can't help, but you can have an L-theanine deficiency. And that could be one of the reasons that you're having those reactions, or that people do, not you. And all of these things that I have here, they're based on deficiency conditions, deficiency diseases. So that's when I don't really come forward and use a lot of herbs, because like I say, we're not deficient herbs, but we are deficient typically in amino acids. Amino acids have to come to us pretty much through the diet. And there are these things called essential amino acids. And that means it is essential that you put those in your mouth to get them in your system, or you don't have them. And there's a lot of really erratic kind of behavior in people, and lack of responsiveness and so forth, that definitely do come from just a shortage of amino acids. Wow. So that would be one of the first things, and then the L-theanine. So what would be a good program? Would be, besides this, the drops.
That should go in your purse.
That should go in your purse, or your wallet, or your hip pocket, but not in the pocket where your cell phone is, in the other one, if you're a guy. So then I would do the L-theanine here, one in the morning, one at bed, and then I would do GABA and 5-HTP, one or two of these at bed to help you calm the brain if you need that help for sleep. So that would be, these things here would be my little trio.
And that would be like for a level 1 stress, maybe?
Oh, it could be for almost any level of stress that is reasonable and manageable, and then it just depends on the dosage that your body needs. So we'd start with those, and then the next thing I would do, absolutely, for chronic worriers, people who, like I said, you've just got that feeling inside you that something's going to go wrong, just really insecure. It's so sad. That can really be helped with this lithium orotate. And that dosage on top of these other things would be 1 twice a day. They can be taken together. You don't need food in your stomach to take these. In fact, it's better. You'll get better efficiency if you take them on an empty stomach. Like I said then, D-L-phenylalanine, if pain is involved, physical pain, more than just life and stress pain, I would have you take 1 or 2 of these a day. So that's what I would do, and it's always a good idea to take some vitamin B12 and folate. I've never tested anybody who really had enough of those levels. Anything else?
No, I think that's
Shelley,
it for right now.
think once,
Well, we got to do the
think
hormone.
twice. Yeah, and then
Hormones
we'll
next.
do the video on hormones as a separate one. But even with those, I love amino acids. These have been so helpful in my practice, because when somebody comes in with that kind of really erratic behavior and they're all nervous, they can't even tell me what their symptoms are, and it's so sad. And oftentimes people will start crying because those thoughts come up when they sit down with me. So sometimes I just want to recommend those 3 or 4 basic things, get them started on that, and have them come in.
And they can buy them on the website.
Yeah. And so these are all available on my website. You can also call the office at 805-969-3600. Like I said, we're at State Street and Carrillo. Got a couple of nice balconies to watch all the parades and fiesta and so forth. So I guess that'll do it for now. DelaneyGabriel.com is my website, and I'm also doing a lot of videos. My video YouTube channel will be up possibly this week, and then also look for me on Facebook. So thank you again. Sure hope that whatever you try, you get the job done, and that you're not out on the street or dealing in other ways to get anything that would be harmful to you in any way. So again, wishing you the best of health. Thank you so much for listening. Bye for now. 18, whoops, I didn't turn it off.